Come on in.
3-year-old Lena feels pretty good today. She's seeing Olivia Kavanagh, a nurse practitioner.
Nurse practitioners can diagnose, prescribe, and they can see patients kind of independently.
The KinderCare Pediatric Clinic hired nurse practitioners when last fall's spike in respiratory illnesses brought overwhelming demand.
Everybody was working their brains out, and we were still turning away close to hundreds of patients a day.
Dr. Dan Flanders' solution, offering patients on-the-spot virtual appointments with a nurse practitioner, but only for those who pay a fee, starting at $29 a month.
It's not ideal that patients have to pay, but it's something. It's going to help increase access.
Dr. Danielle Martin says this is allowed under Ontario's rules. Still, she feels it's unfair.
I do think that this is a form of two-tier healthcare, in that we're talking about giving better or faster access to some patients within a practice than others.
Katie Winstanley goes to a different Toronto clinic. She says her family doctor proposed a similar monthly fee to see a nurse practitioner.
I felt like he was saying, you're not going to find another doctor. You don't really have a choice. If you want to have a family doctor, you have to pay this fee to stay on as a patient with me.
She decided she will pay the $30 a month.
I'm not happy about it. I think it's outrageous.
And this just shows me your oxygen levels.
One twist to all this, in some situations, Ontario actually covers the cost of nurse practitioners, including patients enrolled in a family health team.
If we're pushing for people to see nurse practitioners because it takes some of the pressure off family doctors, then they have to be funded.
And so for those people who say this should be publicly funded, I say I 100% agree.
Ontario's government is not committing to fund nurse practitioners across the board. Mike Crawley, CBC News, Toronto.